Do you have anterior pelvic tilt? I'm going to show you an easy way to start training your core to help give you a more neutral pelvis or a posterior pelvic orientation. Now, an anterior pelvic tilt isn't a disease, it's just an orientation of our pelvic position. So ideally we'd want to be as neutral or parallel to the ground as possible, but from time to time we can get tight in the low and mid-back area or even in the hip flexors, and that helps dump us into this position. So like I mentioned, I'm going to show you a simple exercise. I'm all about simple. What you're going to do, lay on the ground, okay? Knees bent here. To get a posterior pelvic tilt, or at least a more neutral pelvic position, what we're going to do is take our back and try to glue it to the ground. Almost like there's a grape underneath here and I'm trying to make it into wine, okay? Once you have that position there, what we're going to do is just bring knees up. Now, to get a more neutral pelvic position, you'd actually want to, if I'm at 90 degrees here, I'm going to go slightly higher, and that helps flatten my back even more. If I start to go away, that starts to arch the back, and that's not what we want to do because that's that anterior pelvic tilt position. So bringing knees slightly up. If you know how to belly breathe, this is a good time to do that, where you can find your good intra-abdominal pressure. From here, we're just going to slowly tap one heel at a time. So the idea behind this is keeping that good neutral pelvic and low back position as we start to move our legs. And as you do this, you should start to feel some of your core or abs working here. You shouldn't feel the low back cranking at all. If you do feel the low back, know that your default stabilization strategy is trying to crank here into the anterior pelvic tilt for stability. We want to try to train that out of you. If you feel it in the back, take both hands, put them underneath the middle of your low back, and actively push into your hands. You're going to bring legs back up. I'm going to go slow with one leg at a time. As soon as I feel like my low back's coming off of my hand right here, I'm stopping, bringing it right back up. If I keep going further, it's going to dump further into anterior pelvic tilt. And what's the idea behind this video? We're trying to get rid of that, right? So come back up, and then we're going to do the other side. Again, I feel like I'm going to start to tilt a little bit there, so that's as far as I go. And then as you practice this exercise, you should be able to go further and further and even further until you hit the ground without much discomfort at all. So if you have anterior pelvic tilt, don't worry. Do this simple exercise 2 to 3 times a day, doing about 10 for a couple of weeks, and you should notice you have better control of that positioning, especially when you need it most. Do you have anterior pelvic tilt? Give this exercise a try. If you like this video, or you just like simple exercise strategies to fix whatever you have going on, give this a like so I know you like this content, but also comment down below what else you want to see. Whether it's anterior pelvic tilt, rib flare, whatever it may be, let me know what you want to see below. And of course, don't forget to subscribe and hit that little notification ding-a-linger, okay?